Hello, my name is Sarah Kaluza, and today we will talk about how having a graduate degree has impacted my clinical judgment and decision making as compared to those skills as a BSN nurse. There is one particular experience as a BSN nurse that has affected my practice. Also, how the art and science of nursing impacted my clinical judgment and decision making in that situation. Last, we will discuss how a graduate degree affected my individual perspectives of my values and beliefs for decisions in that experience. So let's begin. Hello, my name is Sarah Kaluza, and today we will there will always be that one situation that you will experience that you will never forget. For me, this was in my 9th month after passing my NCLEX, working a 12-hour 6 p.m. to 6 a.m. night shift in an inpatient rehabilitation unit with one other nurse who luckily had been a rehab nurse for 25 years. We had a patient who had been declining all day. He was a cardiac and renal patient and quite fragile. We made multiple calls to the cardio physician that day, voicing our concerns that he was declining and likely needed to be transferred back to a medical floor, or at minimum be placed on telemetry. The physician did not feel that was necessary, despite the updates he was given by multiple nurses that day. He was very restless and uncomfortable when we made our last call to the physician. We were told the nurse practitioner would be by in the morning to assess him and give him his prescribed sleeping pill and call if he declined further. The patient was given the medications and placed on an O2 sensor with an alarm because we just felt uneasy about the situation. We continued to do hourly rounding and about 1 a.m. walked into his room, and at that moment the alarm went off. Thankfully, the other RN was right behind me and guided me as we pushed the code button on the wall, assessed for a heartbeat and breathing, and positioned him for chest compressions. The other nurse began chest compressions, and within 2 minutes, the code team was there. We got out of the way and began giving a report to the code team. The patient was ultimately intubated and did survive. Without even knowing we were using it, we were using the art and science of nursing as that situation unfolded. Once the patient was transferred off the floor, there was now time to begin processing the situation. Were all the right decisions made, or could more have been done? Reflecting on the situation, it is now evident how the art and science of nursing affected the actions of that night. The patient was restless, and the sleeping pill would allow for him to get the sleep he needed, and orders were followed to give him a sleeping pill. This was the art of nursing in practice, thinking about our patient and how he was feeling and what we could do to make him comfortable. Now, thinking about how this could affect him physiologically, the science said to put the O2 sensor on him because we know that sedatives can slow breathing. At that time, there was no more thought given beyond that experience. This is one difference between the thought process of nurses with and without a graduate degree. As a BSN nurse generally focuses more on the bedside nursing aspect and what happened that day. As a master's prepared nurse, the situation will be looked at a bit differently. Both the BSN and MSN nurse will use their clinical judgment to make decisions. This just may look a little different for each. Nurses use clinical judgment every day. Tanner's clinical judgment model is one of the many different models of clinical judgment. The next few slides will discuss Tanner's model and how we use this model every day without even realizing it. We can use Tanner's clinical judgment model in all nursing situations. Step 1 is noticing. It was noticed that the patient was having some trouble that day. His vitals were slightly out of normal range, and he was restless and uncomfortable, just to name a few things. We were noticing the things that were telling us to intervene. This patient had been in the unit for over a week, and his baseline was well known to the nurses. As we noticed the clues, we took into account knowing the patient and their patterns as well as their physical assessment. According to Christine Tanner's review of clinical judgment, knowing the patient allows us to individualize our responses and interventions. Step 2 of Tanner's model is when we interpreted what that meant. It was interpreted to mean that the patient needed some intervention that nursing was unable to provide. An advanced degree is very beneficial in this step. As an MSN, we look back and at each of our prior experiences and ask what those experiences can tell me that can be used in this situation. How can all of the evidence be put together and used with past experiences to help in this situation? That is the thought process when we have that advanced education. Step 3 is where the response happened. There were many times that each of these steps were used throughout the day to make decisions regarding the patient's care. Responses included phone calls, medications, and increased monitoring. Again, what past situations could be applied to the responses in this scenario? Step 4 is reflecting, or looking back on the situation and taking from it new knowledge and more experience. Reflecting now with a master's degree, the difference in thought process goes beyond just the situation during that particular shift. What happened during the previous shifts that contributed to the situation? How did the actions of the cardiologist and physician's assistant contribute? As the nurse, we are the patient's advocate, and even though the physician was contacted, were those actions enough? Was the patient's safety the #1 priority? In Kathleen Masters' Role Development in Professional Nursing Practice textbook, she discusses how important critical thinking is an essential component of professional accountability and high-quality nursing care. Because of the high rates of error and injury that continue to happen, it is crucial for nurses to be able to quickly recognize changes in patient condition, perform independent nursing interventions, anticipate orders, and prioritize, so that anything that may put a patient at risk can be identified and acted on in order to increase patient safety and improve outcomes. As we gain experience, we also gain intuition. In a mixed study review done in 2017 by Christina Mullen Johnson, Rebecca Palmquist, and Linda Ronsberg, they looked at characteristics of nurses' intuition in the nursing process. What they concluded is that a nurse's intuition is more than a gut feeling. They go on to say that it is a process based on knowledge and care experience and has a place beside research-based evidence. They further go on to say that when making decisions, nurses use both analysis and synthesis of intuition along with the objective data. This is what sometimes can give nurses an edge on the physicians, because as the nurse, we are with that patient for a full shift or more. Sometimes we may have that patient on our caseload for a few days in a row. As we get to know the patient, that intuition can be a very important piece of our decision making, as was evident in the noticing step of the clinical judgment process. Put together all of the knowledge and experience you have as a nurse now. Then think about how having that graduate degree can advance that thinking and those skills that will benefit your patients, your coworkers, and most importantly, yourself. As part of the clinical judgment model, we reflect on the situation and take away important clinical experience. Our personal reflection can potentially change our practice. Thinking about the situation and the patient, was everything done the best that it could have? Was the care provided the best it could have been? Is there something that possibly could have been done differently to make us feel better about the situation? If so, what was it? Was the patient treated as gently as possible? Did we advocate enough? Did my fear inhibit my actions? A master's degree in nursing has given me more insight to all of these things and the steps that make me a better nurse and how that can be used to teach other nurses, advocate for my patients, and help improve outcomes by using these situations to learn from. How do we feel personally about the care we provided, and could we do better in the future, is something to ask ourselves after any situation that requires the nursing process or clinical judgment. This is where we gain the real knowledge and insight that makes a nurse the best they can be.